So you've recently shared a number of milestones regarding kind of your lead asset, SAR-bisPSMA, and maybe if we just think about the diagnostic side of it for now, I think it'd be great to get an update. You know, you're in phase 3, 2 phase 3s for that particular product, the Clarify and soon to be the AMPLIFY studies. So I think it'd be great just to get, I guess, a recap and an update on where you're at with those phase 3 programs, importantly, just in recruitment and timelines.
Yeah, we're so excited about SAR-bisPSMA. It's been a lot of work to date, including, as you may recall, going back to the benchtop years ago and building this new product to clearly differentiate ourselves in that market. Now, if we think about purely diagnostics, we know who the competitors are because we've actually completed clinical trials where we've utilized those agents. Now, there's really 3 main players, but one of those PROPELLER out of Blue Earth, but we will exclude that one at the moment because they're obviously finding it hard to get traction in that market because they came to market without a differentiated offering. Yeah,
and you're third to market, and that's
going to be critical. Right? So the 2 main players are gallium PSMA 11, right, which has been commercialized by 2 groups at this point in time. Novartis and Telix have a kit, and then PYLARIFY. So those 2 and where we're positioning is, and I've never been this lucky to move into a market situation like this within a couple of years to go head on with those products that you know, Mel, as well as anyone, when you're looking at diagnostics, there's specificity and sensitivity. To go into a market we're looking at equivalent specificity, same target, same opportunity, but to change that sensitivity and to go against products which today fail sensitivity, particularly in pre-prostatectomy and BCR, how they're structured in prostate cancer, sensitivity is key. Okay, so I'll touch on pre-prostatectomy first. We'd completed the PROPELLER trial. That was head-to-head with gallium PSMA 11, same-day imaging only, and we saw the 2 to 3 times amount of uptake into the lesions compared to that gallium product, okay? So we moved and we utilized that information with the FDA, saying, look at the clear differences between our work, and we also have this next-day imaging, and they awarded us fast-track designation for pre-prostatectomy.
On the basis of the PROPELLER?
On the data, yep. So that's moved now into Clarify. Clarify is recruiting, right? But our plan is to complete that this year. Now, a lot of people have said, particularly in the retail market, oh, you're holding this up, you're doing this, you're holding data. We're not doing anything like that. It's recruiting. We'll look to complete it this year. It is, because some people have said we're doing biopsies in that. It's not. If you read the protocol, which is probably a key area, particularly for retail shareholders, read the protocol. This is a prostatectomy with lymph node dissection. So when they have that operation, then it finishes. That's the end of that. But it's a much larger trial because we're looking at specificity and sensitivity. So we need to have those larger numbers. And so we're looking to complete recruitment this year. And then shortly after that, obviously those results come in. Now that's run by a CRO. That has nothing to do with us, but we'll look hopefully to get that finalized next year as a study and complete. So that's the sort of timelines on that.
Yes.
Now, if we move to AMPLIFY, AMPLIFY is fascinating because we've already got data, and this is where it's interesting against these other products. We've already got data out of COBRA. We already know how good that asset is head-to-head with these other agents. AMPLIFY is just a registrational trial. You go to the FDA, and it's very similar to Condor, which was the PYLARIFY, and then POSLUMA did the same.
Spotlight,
So very similar to those trials, except we have next-day imaging.
Yes, okay.
Now, when we look at same-day, next-day imaging there, it's kind of phenomenal what came out of COBRA. We're detecting lesions that even our competitors couldn't detect 6 months later. Excise the lesion, and there we go. The lesion is positive. These agents were unable to detect it. Now, this is very important because this is usually this patient population is incredibly well educated. They're measuring their PSA all the time. As soon as their PSA goes up, they want to be measured and they want to be treated then because that gives us the best opportunity for cure.
Yeah.
Okay.
As early as possible.
Exactly. So we already know that. We already know how we go head to head. So AMPLIFY will just be registrational, very similar to the others, but Co-PSMA is the important one for us where we already basically know the outcome because we've already done 2 other trials.
And so just to understand Co-PSMA, which is obviously investigator-led, it's not a registrational program. It's something being led by Professor Louise Emmett at St. Vincent's here in Sydney. I mean, that's something that clearly she's driven to do. I guess understanding the rationale, understanding the risk, why as a company you want to take that on, why do you want to put yourself head to head? You don't have to, it's not for a registrational program. But I guess I would say, is it more important for that marketing piece of like entering with a differentiator? Will you see that from your registrational trials, or is that really?
I think there's 2 things here. And key is obviously from a clinician perspective, and Louise just recently did a podcast actually and said this, if something is better, I'm adopting it. And that happened to Axiom when these new products came in. Okay. That's one part. The second part is patients. We need to treat patients better. If we've got 2 products on the market, that's a $3 billion market probably in the next couple of years, and the capitalizations, cumulative capitalizations are probably, they were close to 20 billion based off these assets, and they fail sensitivity, well, we're failing the market. So our position is this. We already know the outcome basically. Mm-hmm. It is low PSA levels, 0.2 to 0.75. In the Co-PSMA, head-to-head with gallium PSMA 11. Mm-hmm. So we can achieve potentially better outcomes for these patients, curative outcomes. That's really the goal. Now you think of the change. So I've just gone through this sort of measure of us against the others. Mm-hmm. And that's what's critical. We're getting this 2 to 3 times the uptake, right, in the same-day imaging, head-to-head, same day. And we know, and I've discussed this just recently as well, but it's important to get this out to our shareholders and others. When we look at our product, same day versus next day, we find a 5 times increase in tumor to background ratio.
Yeah, that next day is very differentiated.
Phenomenal.
Yeah.
And Cobra, we saw that. But when we're looking at then comparison to same day gallium or PYLARIFY, and we're getting this 2 to 3, so now we're looking 10, 15 times difference in that next day imaging. So it gives us an opportunity to change the entire treatment paradigm. Mm-hmm. Early stage, onto the disease early, treat the disease specifically, and it gives the opportunity for men to potentially avoid some of the early lines of therapy that have much greater side effects.
Yeah, okay.
Castration, chemical castration, I don't know too many men putting their hand up for that. But that's what that first line is, ADTs, ARPIs and the like. So hopefully we can actually extend that period of time. And we've measured a whole bunch of men under special access. You can imagine there's men banging down the door at the moment trying to get access to our product. We've actually seen every man to date. We've failed on same day, PYLARIFY or gallium PSMA, Illuccix fail, same day imaging. We image the next day, we've found their lesion.
Yeah. Okay.
And then they've sought other ways, external beam radiation.
External beam, yeah, that's what I was going to say. Are you really providing an opportunity for external beam to be so much more effective because it's earlier?
And to then you think about quality of life in these patients. It extends their quality of life because suddenly they're not chemically castrated.
Yeah.
This is really our goal. So when you ask me that question, what's the goal of Co-PSMA? It's multifactorial. Mm-hmm. We know what we got. We go head to head. The FDA doesn't allow obviously the same target for any of the PSMA studies. So we get the opportunity to go head to head and we get to measure up. But this isn't the first time we've measured this.
No, exactly.
2 trials before. We know what the data says. And now it is to differentiate, and that is recruiting very quickly at St. Vincent's Hospital. Mm-hmm. It's only 50 patients, and we're doing blocks each week, at different weeks. It's like, okay, let's get all these patients done. They have a gallium scan first. They have our scan, all on the same camera.
Yep.
Same tumor.
Keep it all standardized as much as possible.
And we see the difference.